Hello, everyone. I'm Dr. Mike, and welcome to our Free Friday webinars sponsored by the MES Masters Training Series and the MedXPRO Network. We're glad to be here with you on a Friday, and thank you for joining us. Now, I know there are a million other places you could be, especially as the weather is getting better, so we're going to try to keep this brief. And this afternoon, we're going to talk about the 6-point medical exercise management system. Now, this system is more of a mindset than it is truly a system. But folks, quite honestly, all systems are based on a mindset. And the mindset basically says we're going to have a structured process with regard to how we're going to manage the client with a medical condition utilizing exercise. Now, as many of you know, we started the Medical Exercise Specialist Workshop and Certification back in 1994. This is our 30th year. And over those 30 years, we've come to realize that systems are really a good thing for medical exercise professionals and also for medical exercise training outcomes. So with that, we're going to talk about this 6-point system. There are a couple of things we need to go over first. And the first thing we need to go over initially is that of the scope of practice. Now, as I said, we started the Medical Exercise Specialist some 30 years ago. One of the first things we were concerned with when we started the idea was making sure that the fitness professional understood their role and scope as a medical exercise professional. With that, let me make sure everyone understands. Medical exercise training is the development of safe and effective exercise programming for clients with medical conditions. It does not purport to provide any aspect of medical treatment or therapy or diagnostics. So with that, let me make sure that you understand, we should not use the term therapy when we're talking about medical fitness or medical exercise or post-rehab services. We should not use the term therapeutic. We should not use the term treatment. And these certainly are not patients, because as non-licensed medical professionals, we're fitness professionals that hold certifications. Your level of information and understanding doesn't rise to the level of a licensed medical practitioner. Now, I know some of you are very well versed. Some of you are very, very good at what you do, and you're very well educated. But please remember, licensure, when we look across North America, whether we're in Canada or we're here in the United States or even in Mexico, licenses are provided by state or provincial jurisdictions. And they basically say, for the individual to get a license, say as a nurse or a physician or a chiropractor or a physical therapist, they must have completed a university program that was accredited by their particular professional body. For me, it was the American Physical Therapy Association, because I finished my PT program at Howard University in Washington, D.C. And then you can sit and take the board examination, and you have to take the board examination as well as having a background check before you can actually start practicing as a physical therapist or even a licensed physician or nurse or someone along those lines. So please understand, there's a difference between a certification and a licensure, a very, very distinct difference. Certifications are issued by organizations. Licensure is issued by state or provincial jurisdictions. So with that, please understand your scope of practice as a medical exercise professional includes the following: to provide cardiovascular training, strength training, flexibility training. These are the three hubs and the three cores of medical exercise training. But with that, you can also provide aquatic training, stability training, vitally important for clients with cervical or lumbar disorders, functional conditioning, to really take your strength, cardiovascular, and flexibility training and take it to the next level and craft the exercise program for a client to actually reach the next level with their functional capabilities. Lifestyle education, folks, is becoming a bigger component of medical exercise training. The reason? Lifestyle education is something that, with the cutbacks we're seeing in physical therapy or in medical services, particularly the interaction of nurses and physicians with patients, they're the ones that provide a lot of lifestyle education, as well as the therapists. We're seeing now that those visits are being cut back, the sessions are being truncated, and as a result of that, the medical provider doesn't have a chance to go into the depths and answer all the questions for the individual with regard to lifestyle education. That's where medical exercise professionals need to come in. And of course, the assessment is the key to all of it. And of course, you can also provide balance training. Now, let me make one point with balance training. Everyone isn't a good candidate for balance training. A couple of quick things. If the client doesn't have the ability to hold themselves up in an upright seated position, that means they have some level of trunk control. They don't have that ability and they're slumping and they can't hold themselves up. They keep slumping. You have to kind of start to think, will they have the trunk stability necessary to stand and then to actually walk or ambulate? So please, if you would, with balance training, something is vitally necessary. because we're finding more and more individuals are being discharged from therapy services early. But with that, we have to make sure if you're going to do any type of balance training, they are appropriate for balance training, or do they need to be referred back to the doctor, therapist, or chiropractor for further care? Now, this 6-point medical exercise program management concept, you begin with a couple of things before you even get to this 6 point. So number one, make sure you have a referral from a medical professional to work with this client. Now, I know some of you will say, well, Dr. Mike, the client came to me on their own. They weren't sent by the doctor. That's fine. So let me give you a rule of thumb. If the client is less than a year from the onset of their condition, their surgery or their injury, less than a year, so that's 365 days or less, it's probably good to get a referral from the physician or therapist or chiropractor, a written referral. If they are 366 days, so a year and a day beyond the injury, the surgery, or the onset of that condition, guess what? You don't necessarily have to have a referral. And what we're saying here is that first year after the injury, the onset of the condition, or the surgery is the most important year with regard to the rehabilitation process. They need professional rehab services in that first year. They may need them longer, but we know that first year is crucial. So it's vitally important. Let's get them taken care of in that first year with professional rehab services, and then they can be referred on for medical exercise training. So not a mandatory situation if they don't have a referral, but it's certainly one you need to look at from a timetable situation. A year or less, you probably need to get a referral. A year or more, maybe not, but here's the bottom line. Always assess the screen the client. We'll talk about that in just a second, to make sure they don't have any major red flags. Red flags are an indicator the client needs more medical care. Number two, get a good history. Now, I know a lot of our medical exercise professionals, the tendency is you maybe have a medical history form or a PAR-Q. The client fills it out on their own, or maybe they fill it out online, or you send it to them in advance. They fill it out and they bring it in. And the tendency is we stick it in the client's folder, we fold it up, we stick it in our notebook, and we don't go back and look at it. Nor do we conduct an interview and go down every question on that interview form and ask the client. Remember, clients want desperately to exercise. By the time they get to the point they realize they need to exercise, they're probably like, hey, I want to go exercise. I want to do this. They don't want anything to prohibit them from exercising. I'm going to give you an example. As I mentioned before in previous broadcasts, I was a U.S. Army paratrooper. I was young and dumb, and I jumped out of planes. Well, I jumped into Grenada in 1983, and I ended up dislocating and fracturing the hip on a parachute jump. Now, I walked around on that thing for about a week before I was medevaced out. But in that period of time, I ended up having surgery, and I came back on active duty years later. Oh, well, not years later, a couple months later. Went back on active duty as a paratrooper, never had a problem. But every once in a while, after I got out of the service, I would get a job. Remember my first job as a physical therapist after I got out of the Army, one of the questions on the employment application was, had you ever had surgery? And I said, no. Well, I didn't want them to know I had surgery. It wasn't a big issue. So it was, no. No means yes, but no means actually, I don't want you to know. It's not a big deal, so I'm not going to say anything. When your client, you're going through the medical history interview and you ask them, have they had surgery or injury or anything like that? And they say, no, it means yes, but it's not a big deal. I don't want to tell you. And that's the situation that you need to know more about. So in that situation, ask the client more questions. Mr. Jones, did you have surgery? Yeah, I had surgery when I was 22 years old. I had a couple of pins put in my hip. And I was a paratrooper. I went back on active duty. I went back on jump status. I made another 13 jumps, never had a problem, whatever. Is that something you need to know about? Yes, you do. Maybe I do have some weak musculature from that injury years ago that might play into now some issues I'm having with a knee or a hip on the opposite side or the same side. So get a good history. And in that history, make sure you do an interview. Number three, perform an assessment or a screening to make sure the client is appropriate. Now, I know for a lot of our medical exercise professionals out there, you want to get to the exercise. That's what the client paid you for. And I've heard that from numerous students in our MES program. Well, they did pay you for the exercise. That's what they're there for. But they also want you to do that, perform that exercise or develop that program effectively and safely. So make sure you do the screening and the assessment first, either one, to make sure the client is appropriate. And remember this. Just because Dr. Smith told them to come see you or the therapist told them to come see you or the chiropractor does not mean they're appropriate for exercise. The insurance coverage may have run out. The therapist or the chiropractor said, hey, go see Joe. Well, they go see Joe and you're not equipped to deal with the level of involvement they have. They might need to go back. So please, if you would, make sure you do these 3. And that now gets us to the point of performing the 6-point system, or utilizing the 6-point system. Now, folks, I've had the great opportunity of teaching in 3 medical schools. I've taught in 3 medical schools here in North America, teaching primarily in the orthopedic surgery component of the medical school. So these are normally medical school graduates that have now come in and they're doing their orthopedic residency. I also taught in a physical medicine or physiatry residency once, and as well as a couple of PT schools. The one thing you learn with medical professionals is everything we do is based on a systematic approach. We don't just make it up. It's based on basic sciences, anatomy, pathology, physiology, chemistry, things of that nature. And then we layer the information and the clinical procedures on top of that. So with that, the medical provider gains a mindset as to how they're going to look at the client. So our 6-point management system is more of a mindset than it is truly a system. But folks, every system is based on a mindset or a series of procedures that you'll follow to get to a particular outcome. So let's talk about this 6-point system. There it is right there. Now you notice it's a pathway. It's a road or a highway. And what it's doing here is starting here at the bottom, and it's leading the client all the way through to a positive outcome at the end. That's what becomes important. The positive outcome is what we're looking for. And along the way, we want to make sure that we take into account every aspect of the factors that may impact on this client to get them to that positive outcome. So when this client comes in the door, we need to have a certain mindset. And it was interesting when I was teaching at Howard University, we had then a gentleman who's the president of the American Academy of Orthopedic Surgeons, was the chairman of the orthopedics department. I got a chance to speak with Dr. Epps many, many times over the years I was there. And he told me one thing. He said, every clinician must have a vision in their mind of what their practice management system is. He said they have to see a pathway. And that's why we gave you a pathway. And this pathway along the way, some of the aspects change, but some of the aspects remain the same, which means it gives you a mindset that's a consistent pathway that you're going to follow. So with this 6-point medical exercise training management system, what we're going to do is give you a step-by-step thought process that you need to consider when you manage every medical exercise training client. And literally, folks, this system or mindset or thought process should always be in your mind, or at least in the back of your mind, every time the client comes in. And it's the same for every client, but each client has unique components in the system or the mindset. So it's going to be 6 components. What you should have is a handout that will allow you to write these in. You also have a multi-page handout. I believe on the last page of that multi-page handout, you may have this document. If you don't, we will make sure that you get it. So when you download this at the end of the session, or you download the session guide, you will have an additional component that actually is this sheet so you can write these in. Now, if you look in your handout that you have right now, it's a multi-page handout. And with that multi-page handout, we have actually diagrams of this, but they're completely filled in. So if you would, let's go ahead and get started with number 1. All right. Now, number 1, you'll notice what we're starting here. The pathway is here, starting at number 1 here at the bottom. We're going to follow this meandering pathway all the way through, and it's going to take us all the way to a clear understanding of clinical anatomy and pathology. So that's where we're going to start. Number 1 in this process is a clear understanding of clinical anatomy and pathology. Now, client comes in the door. Now, remember, you have a referral from the doctor, therapist, or chiropractor, or the client is beyond a year since the onset of their condition, their injury, or their surgery, and they're more than a year out. So you don't need a referral. You've done the screening, you've done the assessment, there are no red flags. So with that client now, you've done the assessment, you're ready to get them started. So one of the first things is, as you're doing the assessment and you're doing the history, you get an idea of what's going on with them. You start to realize that you have to have a clear understanding of the clinical anatomy and pathology of the client's condition. You must. You can't just simply say, I know the muscles and bones that are involved. You have to really understand what the client's condition is. This is where now you have to have a very good education in medical exercise training. And that education should be based on a clear understanding of clinical anatomy and pathology of the most common conditions you're going to see. No program can ever train you to work with everything you'll ever see. Even medical schools don't train individuals to work with every condition that they'll ever work with. But or providers, I should say, nurses, physicians, so on and so forth. But at least it gives you a basic understanding of most common things that you'll see. So with this, please, if you would, make sure you understand clinical anatomy and pathology. Clinical meaning not basic gross anatomy. For most personal trainers, you're learning basic gross anatomy. You're learning muscles, bones, the skeletal system, the organ systems. You're learning basic gross anatomy. The next level of anatomy is what we call clinical anatomy. This is where we look at the basic gross anatomy, the major organ systems of the body, the muscles, the bones, the skeletal system. And then we say, okay, when there's a disease process or an injury, what has gone wrong or what has occurred? That now brings us into the area of clinical anatomy and clinical pathology. Clinical anatomy means how does this anatomy work when there's an injury that occurs? And the pathology means the disease process. So the basic gross anatomy that you learn in your personal training course is the foundation. The next level that we layer on top of that in our medical exercise specialist training series is the clinical anatomy. What does that hip look like when it becomes arthritic? So you learn the basic gross anatomy, the muscles around the hip, the bones, the acetabular, the femur head. You learned about the greater trochanter. You learned about the gluteal muscles and the deep hip rotators. But now clinical anatomy says, what happens when this hip is replaced? What happens when this hip becomes arthritic? What happens with the bursitis? So now you go in a deeper depth into the anatomy, and now it's clinical anatomy. And if there's a disease process or something that's gone wrong, now that becomes the pathology. You always have to keep that in your head when you're looking at this client, whether it's the first session or the third session or the 54th session. Always in the back of your mind, you have a clear understanding of the related clinical anatomy and pathology of their condition, which leads us to number 2. Recognize the contraindicated activities or exercises. Now, folks, this is now where you're starting to look at what should I not do. Now, I may date myself here. Years ago, there was a show on, it was on NBC. It came on, I think, on like Wednesday nights called ER. And it was a great show. A number of individuals that were in that program went on to have great careers as movie stars and television stars. But basically what it was the life of a number of residents in a emergency room in Chicago. Well, what would happen is literally on every show it would start out, the ambulance is barreling along at some crazy speed trying to get to the hospital. The paramedics are working to save this person's life, and they finally pull up in front of the ER doors, and they have the patient on the gurney, and they're out of the ambulance and open the doors, and they're into the ER. And one of the first things the paramedic says is he gives the physicians there a basic understanding of what's going on with the patient. This individual had this injury. Here is blood pressure, his vital signs. Here's what's going on with them. And then one of the physicians will ask, are there any allergies that you're aware of? Because remember, they probably picked this person up at home, or maybe there was a family member, or maybe they picked them up wherever. The paramedic may have more information they have. Most important thing they're asking is there anything this person is allergic to? Because you can have the greatest medical center, the greatest physicians, the greatest care, but if the client is allergic to penicillin and you give them penicillin, it's going to kill them. So it's the same thing that holds true with medical exercise training. You have to recognize, based on the client's condition and your understanding of the clinical anatomy and pathology of that condition, what are the contraindicated activities and exercises? What should we not do? What should we not do with this client? Because that becomes vitally important. Because if we do it, we make them worse. So I'll give you an example. We had a young man going through our MES program, relatively new to the program. And he called one day. Now, he was looking at the MEST modules, medical exercise training series modules on the shoulder. So he's going through the program. And as he's going through the program, he has worked with a couple of clients that have arthritic knees. Now, he hasn't gotten to the components of the knee yet. And he emails me one day and says, Dr. Mike, I can't understand why a number of my senior clients that have arthritis are having significant problems with doing HIIT type exercise programs. I think everybody would know HIIT, high intensity exercise programs, are not appropriate for the arthritic client, especially arthritic knees where you're doing the impact. So that was a contraindicated exercise or activity. So every time he had the client doing the activity, they were never going to make any progress because it just simply inflamed the area more. So always understand and keep in the back of your mind what are the recognized contraindicated activities and exercises. Number 2, what are the key assessment procedures that need to be utilized for this client? So based on that condition, do I need to get an understanding of flexibility of their lower extremities or their upper extremities, as well as strength of the upper and lower extremity or an extremity? Do I need to get an idea of what their balance looks like? Do I need to get an idea of their posture? Now, most of you will say, well, I do all those things, Dr. Mike, but do I need to look at even greater depth at a particular joint or muscle or plane of movement or a particular activity? So we always have to understand what are the key assessment procedures I need to look at with this client. And then these key assessment procedures, I'll repeat periodically as the client is progressing to show that if they were here on day 1 and now they've progressed, they've gotten here on day 21, that means the client has made progress. And please, if you would, with those assessment procedures, we're really looking at their functional capability. And we want to make sure that we're able to measure that functional capability utilizing functional outcome measures. Give you an example. Let's say the client is diabetic and the doctor has provided you with their A1C value. If the A1C value starts out as, say, 8.3, over the course of time, you work with the client for, say, 9 months, we're hoping that A1C value starts to diminish a little bit. Or maybe the range of motion is limited. We should see those range of motion values increase with strength and stability. So these key assessment procedures are assessment procedures that we want to look at and evaluate and determine where the client is to get a baseline, but we also going to use those assessment procedures to determine if the client is making progress down the road, which takes us on to number 4. Incorporate indicated activities and exercises. Okay, so what are the indicated activities? What are the exercises we should do for this client? Example, the client maybe has undergone a laminectomy or a spinal fusion. One of the key things we want to do with this client is improve their level of stability, as well as with some areas of their lumbar spine and their lower torso, we want to increase flexibility. So we want to incorporate the indicated activities and exercises, but also have to remember there's some contraindicated injury activities and exercises we don't want them to do. So we always have to be mindful of all of these things with every session the client comes in. So literally, folks, with this 6-point system, you're going to have a brief thought about this 6-point system when they walk in the door for each session. You may flash back to this 6-point system and remember some of these as they're going through the training session. And you may make a determination on adding or removing exercise. It's still based on these 6 points. And we're only at number 4. So number 5, understand progression guidelines and functional goals. How are we going to get this client from point A to point B and point C and then all the way to point Z? How are we going to progress the client? What are some of the things we're going to do along the way? So when we start out immediately doing wall squats, or maybe we need to use something like a leg press or bridging initially. It really allows us to perform the assessment, and based on the assessment, looking at where the client is, where are we going to start and how we're going to progress the client, and what are our goals along the way? So here's what's happening. When we started the medical exercise specialist back in 1994, it was the idea of there was a direct handoff from usually the therapist or the chiropractor to the fitness professional. Well, folks, things have changed. 30 years later, the healthcare system has really changed significantly, and the utilization of physical therapy has been diminished. And with that, now, in many instances, you're on your own trying to figure out what's going on with this client. So you may have to determine what the progression guidelines are and the functional goals. And with that, you may have to communicate those back to the doctor, therapist, or chiropractor. And now, in 2024, you may even have to communicate those goals to an insurance carrier who's going to pay for the services. So you need to have not only progression guidelines, but goals with those guidelines as to where the client will be in 30 days, where the client now should be in 60 days. And then your exercise program should support and enhance the client's capability to reach that 30-day goal, eventually to reach the 60 or 90-day goal. So these progression guidelines are coinciding with your functional goals. So we have short-term goals that are 30-day goals, and then long-term goals that are 60 or 90-day goals. And here's the great thing, folks. If the program is working, you reach the 30-day goals. They're now eliminated. Those goals you set initially for 60 to 90 days now become the new 30-day goals, and you set more goals. And especially now in this era where we're starting to see medical professionals, physicians, and therapists and chiropractors are now realizing and on a regular basis referring on to medical exercise training, and insurance carriers are paying, progression guidelines and goals become more and more important, which takes us to number 6, use a protocol-based approach. Now, folks, everything in medicine is based on a protocol. Everything in medicine is based on a protocol. And please, if you would, I know most of you are lone rangers. You do your own thing. You're independent minded. You've taken the greatest fitness and exercise courses. You know all the techniques. But folks, sometimes following a protocol that you may develop in conjunction with your colleagues or something that's out there that's been a standard protocol for years actually is a good thing. And let me give you an idea. We've all heard of Johns Hopkins University in Baltimore, Maryland, one of the top medical facilities in the world, top medical schools in the world. Well, several years ago, they did a study and they found that in their surgical ICU, they had a number of individuals that were in the ICU that were developing infections, and they couldn't figure out why these infections were occurring. And they had some of the best and brightest that were there as residents, nurses, or attending physicians. And what they found with these staff members that were coming from a gamut of nursing or physical therapy or surgical or medical school programs from around the world, every one of them had learned how to do sterile procedures a little differently. Sterile procedures being when you go into a sterile area, how do you mask yourself? How do you gown yourself? What gloves do you wear to protect the patient from any infections? Well, some would wear the hat and put on the mask and the gloves, but wouldn't put on a gown. Some would put on the gloves and not put on the mask or the hat or the gown, or some would just put on the gown and just the gloves. What they found was this inconsistency was the problem. So they came up with a protocol that regardless of what your education was or what your position was, if you went into the surgical ICU, you would wear a hat, mask, gown, as well as gloves. Guess what happened to the infection rate? Went significantly lower. With that, they came up with a protocol. A protocol isn't bad, but when you make up your own protocol without doing any research, without checking with others, sometimes that can cause a problem. Now, this is our 30th year of the medical exercise specialists. When you look at that, we're still kind of in our young adulthood. And across the world, medical exercise training hasn't become standardized. So here's the one thing that I'd like to see us do over the next 10 years is as a profession. We have a new profession, folks, medical exercise training. It's not just simply a side way or an additional component, additional certification to get a few clients. We're now starting to see the medical community recognizes that exercise is an essential component of medical management of clients with long-term medical conditions, and in some instances, even moderate to minimal level conditions. So with that, we need to establish guidelines and protocols that we all are using with some modifications so that we now have unified guidelines and unified outcomes across the profession. So utilizing a protocol-based approach isn't a bad thing. The protocol actually gives you more freedom because it makes sure nothing falls through the cracks. With those protocols, you may modify the protocol for a client that has a hip replacement, but also has a respiratory issue. A client that has a respiratory issue, but also has a stroke. So here at the Medical Exercise Training Institute, in our post-rehab conditioning specialists, as well as our medical exercise specialist program, we built those programs based on 62 protocols for the most common conditions that you'll see in a medical exercise training or post-rehab environment. With those protocols, they give you guidelines. They don't handcuff you. They don't keep you from doing anything you want to. They just give you guidelines so nothing falls through the cracks. If you need to train certain muscle groups to see the client improve in their level of function, if you need to work on certain areas such as cardiovascular training or flexibility training, it's all included, as well as looking at key areas to assess along the way and key assessment procedures. So protocols aren't a bad thing. They actually can help produce better outcomes. And what we'll find, hopefully over time, as we come together as a profession, we'll find out that there's certain aspects of protocols that we need to modify and add more, or certain aspects of a protocol we need to diminish or take away from so that we get the optimal outcomes. So this 6-point program isn't necessarily a program or a system, it's a mindset. And folks, I can tell you, as a physical therapist for 30 plus years, every time I saw a patient, this was always in the back of my mind. It was always there in the forefront or the back of my mind from the standpoint of what's the related anatomy and pathology? How's that anatomy and pathology being impacted with the activities or exercises I'm doing? Is this a contraindicated exercise that's going to make them worse? We looked at that assessment procedure early on, do I need to reassess it again? And based on what I found with that assessment procedure, how does that now change the exercise program? With that, what are the indicated exercises? And these indicated exercises may change along the way as the client progresses. And with that, I have progression guidelines and functional goals. And as those progression guidelines progress or maybe regress, depending on how the client does, those functional goals may change. But I'm always developing the exercise program to reach those functional goals, whether short-term, 30 days, long-term, 60 to 90 days. And we use a protocol to make sure nothing falls through the cracks. So it's a system, but it's really a mindset. Now, with that, you should always kind of see this in your head. Okay, always see this in the back of your head. What is the related anatomy and pathology? What exercises should we not do? What assessment procedures do we need to look at? Maybe we need to look at them periodically, every 30 days or every week. Reassess the client. What activities should we do at certain stages? And as we progress this client, what exercises are done at certain stages? What are the goals that go along with those stages? And are we utilizing a protocol to make sure nothing falls through the cracks? Folks, as you can see, this system really does set the standard across the board for allowing you to work with any type of client, whether it's a client with a cancerous lesion or a surgical intervention afterward, to a client with a cardiovascular disorder, to a client with a total hip replacement, to a client with a disc herniation. It works across the board for everybody. And we've taught this in our medical exercise specialists and post-rehab conditioning specialist program for 30 plus years. So with that, we're going to conclude. But before we conclude, a couple of quick things. Since we started the medical exercise specialists some 30 years ago, we were the first organization to offer the medical exercise specialists. I think our program is more comprehensive and detailed than the others. It's not simply read a book, take an exam. We have some 44 hours of video training that you have to go through, as well as, I think our manual is some 1,000 pages with protocols and handouts for the course, along with quizzes and a final examination. But with that, we realized for many of you, when you finish, you're a lone ranger in your community. You may be the only medical exercise professional in your gym or in your entire community or in your region of the state or province. So we put together our MedXPRO network. You can go over to www.medxpronetwork.com. It's a community for medical exercise professionals. And we have a number of resources and courses and support systems there where you can communicate with other medical exercise professionals. And we urge you to join our MedXPRO network. It's the only network designed specifically for helping medical exercise professionals improve their skills, build their practices, and most importantly, connect with medical professionals. You'll find like-minded individuals there, so we urge you to go over to medxpronetwork.com and register. We have a number of components and items that we offer there and resources that I think you'll find helpful, especially our MES Masters series that meets every other Thursday evening, where we present through our medical exercise professionals around the world, the most challenging clients they're working with, just to give you an idea of what everyone else is doing around the world. The other thing that we're just releasing is our MedXPRO Mastermind Business Blueprint Accelerator. Folks, this is a mastermind group. We're going to open this up. It'll actually start in April of this year, I believe April 13th or 14th. I'm not sure of the exact day. But we're going to bring together our best and brightest medical exercise professionals, whether you're a PRCS, an MES, an MEPD, or a medical exercise specialist advanced. You can join this program, and it's all about helping you build a stronger and more viable practice. Folks, we've been doing this now for 30 years. We started it, and I am immensely proud of all of our MESs. I actually have even greater respect for those that have built practices and now financially are stable. They are paying their mortgages. They put their kids through college. They built businesses that are financially viable and survivable and sustainable. We want to see all of our medical exercise professionals do that, whether you're a PRCS, an MES, an AMES, or an MEPD, and you are just starting out and you've been doing this for 20 years. The business mastermind is designed to bring you in and give you one-on-one coaching, as well as group coaching with other like-minded individuals. Because one thing we know, folks, one brain doesn't have the capacity of multiple brains. We're going to open this program up to, I believe, 10 or 12 participants at max. And each month you'll get a one-on-one coaching session, as well as a group coaching session. And it's all focused on you building your practice. It's a 6-month program. And you'll notice here, we have clarity, systems, specialization, marketing, relationships, and execution. We'll have a group session each month that'll look at one of those items. And with those items, we're going to then ask you at the end of the session to go off and look at those items and now utilize each one of those each month in helping you get better clarity, develop better systems in your practice, develop specializations that will attract more clients and help you in marketing in your community, as well as developing relationships with medical professionals in your community so you can get referrals. And lastly, being able to execute all of this and produce great outcomes. So folks, we're not doing this just for the heck of doing it. We're doing this because we want to see you actually grow your practices. That's why we have free webinar Fridays. That's why we have the MedXPro Network, and that's why we're offering now our MedXPro Mastermind. Go over to MedXProMastermind.com. This program begins on April, I believe, 13th or 14th. I'm not sure the exact date. I'll be your primary coach with some of our other MESs that have been successful out there around North America, and they will help coach you through building your practice. Folks, I can tell you this. Building a medical exercise training practice is not the same as building a personal training business. We actually did a blog post on that a couple of days ago. Personal training business, you're always fighting for new clients. You're always discounting your rates. It's always a new gimmick. Whereas the medical exercise provider or practice owner does something different. I can give you a couple examples. Susie Dutke of Lake Bluff, Illinois. Rob Kronberg. Rob is also near Lake Bluff, Illinois. Some of our others, Jason Hodge here in Houston. They built practices, and these practices are basically managing clients with chronic medical conditions. They're communicating with physicians and therapists, and they're getting more referrals, not only from the medical community, but from the clients that are coming in and receiving the services, and they're telling everyone else about them. They don't have to discount their services. They don't have to discount their prices. They're communicating and being looked upon as professionals by the medical community. And folks, that's where you want to be. You don't want to end up being a personal training business where you're fighting the competition and you're lowering your prices. You want to be in a medical exercise training practice where you can continue to produce the best outcomes. Those will attract clients and you'll develop relationships with the medical community. More importantly, you're going to tap into the baby boomers, and they are the most economically stable group in North America right now. And folks, quite honestly, I'm in that group. We need the medical exercise training services. So with that, we're going to conclude for today. Thank you for joining us for Free Webinar Friday. We'll be back next week. If you have any questions for me, email me at drmike@postrehab.com. And don't forget to check out the MedXPro Network and also check out the MedXPro Mastermind Business Blueprint Accelerator. We'll see you then. All the best to you. Take care. And thank you for joining us.